sure your microphones are muted. As you have noticed, all microphones are by default on mute, but if you want to speak, please remember to indicate so in the chat and mute your microphone after again. If you want to ask the questions, there are different ways to do this. The first option is to do this in the chat. The other is to, and then after one of the moderators, myself or Vivian at APECGH will give you the speaking privileges. And we will be using a program called Mentimeter for in the beginning, so please make sure that you have your phone ready to answer a few questions to get to know each other better. I will skip this for now and instead want to give the floor to Ms. Koiwah. Koiwah, are you available? Oh, I think you need to unmute yourself. I will do it manually. Yes.
Can everyone hear me now?
Yes, we can. The floor is yours.
Okay, good morning, everyone. It's good to meet you all today, online. I never thought our second scientific meeting would be here, but here we are. So today is World Pre-Eclampsia Day, and so we are commemorating the day by having this event online. My purpose here this morning is to tell you why we are gathered here, the purpose of this gathering, basically. And so I'm going to do that by just reading something brief that I put down. And I would want you to pay attention. So, ladies and gentlemen, distinguished speakers, all protocols observed, good morning once again. My task here this morning is to tell you why we are gathered here today on this platform for this meeting. Let me do that by allowing us to relive the experience of a wonderful Ghanaian family. If you are a woman, imagine being young, in your late 20s, exuberant in character, married and living in Ghana. If you're a man, imagine being a young lawyer and a husband to this woman. As a young couple, you were lucky to have conceived the same year you got married, somewhere 2012. Such excitement you exhibited as you started your 9-month journey of the unknown. As a pregnant woman, you diligently attended regular antenatal at a private hospital with your husband. As the months passed, you observed drastic changes taking place in your body. You gained excess weight, but you received praises for it and was told it was a sign you'll be having a baby boy, although the scan said a girl. You sometimes felt unwell and had headaches, but presumed it was normal. When you complained a few times to a nurse during your antenatal visits, you were told you will be fine. Never did you ask any question, but to accept what you were told by your health practitioners because you had confidence in them. 27 weeks down the pregnancy lane, when you finally complained to your husband one day, he told you to rest more, and you did. However, as around 2 a.m. the following morning, as you were resting, you started shaking vigorously, foaming, and gradually becoming unconscious. The last you could hear before you passed out was your name being called, but you could not respond. Between the time of your unconsciousness and consciousness, almost 24 hours thereafter, you woke up to a severe pain, a severe abdominal pain, only to be told that you were rushed to a public hospital and had been delivered through an emergency cesarean because you suffered eclampsia. Never had such a strange name passed through your ears. Where is my baby, you asked? Your baby is fine, and at the neonatal intensive care, you were told. After 3 days, you managed to walk to the NICU to see your premature baby, who turned out to be a boy. So tiny and frail was your less than a 1 kg baby, whom you bonded with over a period of 3 days. Few days after, you were discharged and told to come to regularly check on baby. Sadly, when you visited the following day with your husband, the baby had died due to respiratory failure. And that was the beginning of your long journey with pre-eclampsia, eclampsia, and HELLP syndrome. Fast forward a few years, you and your husband lose additional 2 babies due to pre-eclampsia and HELLP syndrome in 2017 and 2020, respectively, all of which you were delivered surgically. Your last experience was nothing but a life and death situation. Out of 4 pregnancies, you have only 1 surviving child, your miracle baby, your second child, with whom you did 6 months antenatal in Ghana and traveled to the US for further care. Unfortunately, you delivered the bouncy baby girl at 37 weeks, even though you still suffered pre-eclampsia, but at a later onset. Ladies and gentlemen, this is my story. This is my suffering. This has been my faith. And this is the inspiration behind the formation of Action on Preeclampsia Ghana, the organizers of this scientific meeting. My fellow participants, losing 3 babies to preeclampsia, eclampsia, and HELLP syndrome is tragic. As others receive accolades of congratulations, you receive accolades of our condolences. But don't we all deserve the congratulations? As a couple, we've been traumatized physically and emotionally over and over again because of this disease. Not to talk of the huge financial burden associated with it. My life has been at risk because of this disease, and I ask why. Where did we go wrong? Yes, with the first pregnancy, we were ignorant, even as intellectuals, but subsequently, we were not. Such that with the last pregnancy, we did all that we could, from self-monitoring of blood pressure, frequent antenatal visits, healthy diet, exercise, diligent intake of medications, and yet, just 4 weeks ago today, we lost our premature baby girl, Grace, born at 30+ weeks, weighing 0.9 kg. So much tears have I shed as a bereaved mother, so much pain have we bore as bereaved parents, with only 1 child to compensate our pain. So I still ask why. What needs to change? Can we ever defeat this disease? And I say, yes, we can. Fellow doctors, nurses, researchers, policymakers, advocates, and students gathered here today, I share this story not to discourage us, as I almost was. I share this story rather to empower and remind us that there is still more work to be done. I share this story not to downplay our progress as a nation in healthcare, but to let us know that as a scientific community, we have come far, but we still have a very long way to go when it comes to this disease. And this is the reason why we are gathered here today, to share ideas as experts on how to deal with the fatal stings of preeclampsia and its impact on women and families. Under the theme, Preeclampsia Vigilance in Screening, Diagnosis, and Management. As we deliberate today, I leave us with these questions to ponder over. As Ghanaians, as experts, do we have the passion and capacity to deal with this serious pregnancy disease? Do we have the passion and capacity to ensure that no woman dies giving birth? Do we have the passion and capacity to ensure that every baby is given a chance at life? On this note, I entreat us all to enjoy the meeting, engage each other, and come up with an action plan to defeat preeclampsia. Thank you.
Thank you, Koiwah. I'm going to start a short video that was shot in 2018. Let me share my screen again. And it also tells your and your husband's story.
Thank you, Joyce.
According to experts, the health of...
Just a minute.
Women and children has become established as one of the most important indicators for measuring a country's level of development. The World Health Organization, for instance, explains that the well-being of societies is directly linked to the health and survival of mothers and children. When mothers survive and thrive, their children survive and thrive, and societies prosper. For Koiwah, enough is enough. She is unwilling to risk her life again in an attempt to have another child.
Anybody hearing me now with what I'm about to say will say, what kind of a woman is this? But I pray to God, telling him not to give me a baby. I pray. That is the sort of prayer I pray. At times I miss my mess, they're like, oh, the babies. I'm like, is that normal? It's not, because I said I don't want to go back to that operation room. It's a very scary place, between life and death. And if you have to go there twice, like I have, go into so much pain and come back with no baby to compensate your wounds, then I really can't go there. I can't go there again. And so I told my husband, I know I'm still young, there's a potential, but I'm done. I tell the doctors, and they're like, oh, well, now that we know yours is like a hereditary thing and you're like high risk, we can manage you. I'm like, no, I want to be there for the at least one that I have.
And her husband, Dennis Ofusuapia, supports the stance.
In my view, I think it's okay. That is what I keep telling her, because it is life-threatening, and she has gone through this 3 times. Even Dioli, she had it, but it makes us almost draw the same conclusion that because of the system where she found herself, they managed to keep it down for at least 2 weeks before finally they took Dioli out. So she has suffered too much, and I think that you have 1 child. It's okay. Others don't have.
Oh, I'm sorry.
Have 1 child. It's okay. Others don't have, but they are there. So as far as I'm concerned, I think we can live and be okay with ourselves, with our child, and move on in our life.
Nobody jokes.
Okay. I saw in the chat there was one request to post the link to this video, and we'll post it shortly during the presentations. So you can also watch the full Joy TV screening. Thank you again, Koiwah, for sharing your story. And at the beginning of this scientific meeting that brings together many people with very different interests in hypertensive disorders and pregnancy, to the real purpose of why we're doing it are stories like yours. So thank you for sharing. I would like to invite, just a minute, Marcus Green next. APECGH, one of APECGH Ghana's partner organizations is Action on Preeclampsia UK. Marcus, can I invite you to share your thoughts?
Good morning, and a very huge thank you for inviting APECGH in the UK to join you today. It's the most enormous privilege to be a part of your conference and a part of your meeting, and to hear what Koiwah had to say. It just puts everything into perspective, doesn't it? That we are patient-led organisations. We're here to work on behalf of patients, and we're here to make sure that the very real stories that we hear day in, day out become rarer and rarer as we work to deal with preeclampsia. Koiwah has been an absolute inspiration, as have the team that have set up APECGH Ghana in the last few years. And it's a great privilege and a great honour to work alongside you. And thank you very much, as I say, for inviting us to be here today. We live in very interesting times with COVID-19, and it's quite clear that it would have been very difficult for APECH to physically come and see you for this meeting. So the fact that we're all online brings the worlds a little closer together and makes everything a little bit smaller, and it's a great pleasure to be here. And what I certainly couldn't have done was bring members of my team along to the meeting in Ghana. So I'm very pleased that both Rowan Wiseman and Rowan Grigg and Charlie Gledhill, who are both members of the APECH UK team, are listening in on this meeting and looking forward to hearing what's discussed. And also Professor Andrew Shannon, who's my chair of trustees, will be joining in later. So thank you very much for that. I think that there's much that APECH in the UK can gain from working closely with APECH in Ghana. We bring different perspectives to the same problem, and the more that we do to work together, the better. And on this World Preeclampsia Day, it's lovely for us to be able to share some of what we're doing in the UK. And I particularly want to mention the launch of our YouTube channel today. We've just launched that, and we've got about 12 videos on there, including some from the Happy Project, which is really important to us. And we're very, very pleased that that's been launched today. And if you go to apec.org.uk, you'll see a complete page of new resources that we've developed, including a new Instagram page as well, launched this week. Now, finally, what I would like to say is one thing that we've worked on very hard in the last couple of years is our training for healthcare professionals on preeclampsia. And I'm very pleased to say that this now has continuing professional development accreditation. So that has been launched today. You can get details of it on the website, and it's completely free of charge. So any midwife who would benefit from signing up to that, please do so. Please use those resources, and please work with us so that whatever you need from us and however we can work more closely together, we'd very much like to do that. I'm aware that time is running away, so I will leave it there. But Dr. Brown, thank you very much for having me. I greatly appreciate being here.
Thank you. Are there any questions so far? For either Marcus Green or Koiwah? If so, please.
No questions. No questions, Joyce. You're fine.
Okay. As I mentioned, we are with a very diverse group of people. So what we would like to do is get to know you better for those who are joining us. I'm going to share my screen again. And what I would like you to do is go to the website www.menti.com. And you can do so either through your web browser or your phone, and use the code 259667 to answer a few questions so we know who's here. So the website is www.menti.com, and the code is 259667. If you cannot join because you are using your phone to dial in, just answer these questions in the chat. So we want to get an idea of who's here. I see 2 people found their way from the Netherlands, someone else from the Netherlands. As you can tell, we are using this often also in our education. So the Dutch people here have a slight advantage. Someone is joining from Burundi, and I think I know who that was. Welcome to Tarek Nagit, an obstetrician gynecologist in Burundi at the moment. I see in the chat some people also start responding. London, Hazel Fofi.
That's great.
Someone is in Georgia at the moment.
Yes.
In the UK, in England. From Ghana, in Germany, in Accra,
Great. We
Edinburgh. Many people say Ghana. Are you all based in Greater Accra region or other cities in Ghana too? in Takoradi, Accra, Austria. And it's one of the beauties of, or one of the advantages of our new online world and reality is that it is easier to connect across countries without having to travel. I see someone joined, or 2 people joined from Kumasi, Isaac Boateng and Mohammed Ainoson. Someone from Abuja, Alexander Dachun. Someone from Accra, from Wa in the Upper West region in Ghana. Worcestershire in England. It's nice to see who we have joined, and there will be a recording of this meeting, so also after many more people in the world will hopefully see this. I'm going to move on to the next question. And that's a question about who you are as an audience. So what drives your interest in hypertensive disorders of pregnancy? Are you a health professional, a policymaker, a researcher, a survivor or current patient, a family member, a student of medicine, midwifery, nursing, or other? And if Mentimeter doesn't work, please indicate it in the chat too. We're very curious to hear who we have in our audience. We also realize some of you may actually have more than one professions or reasons to be here. So one of the inspiring things about Action on Preeclampsia Ghana is that many, well, all its members are preeclampsia survivors, but many are also professionally interested as a researcher or health professional in the topic. In the chat, I see a few answers. Agnes Asante, welcome. You're a midwife, a 4th-year medical student. Fatima Adaham, another midwife, Janet Ajamang, a clinical pharmacologist, researchers, and medical students. You're combining 3 hats. A midwife, final year medical student. And in the Mentimeter overview, you see the distribution. So close to 40% who answered this out of the 32 is a health professional. We have about a third who join us who are researchers, probably from many different disciplines. I saw in the list some an anthropologist. My background is clinical epidemiology and medicine. There are a number of clinician researchers I know. I see Ernest Obeng is a physician and health and safety specialist. So we have a very diverse group here. And to all the students, also very welcome to you. We're very happy that in an early stage of your professional career, you already encounter and learn about preeclampsia, as it is one of the main causes of maternal morbidity and mortality. It's important to join. One technical notice, I see Hazel asked a question if there is a maximum amount of participants who can join. That was the setting before, and it's just changed. Now everyone is able to join with a maximum of 500 people. Okay, let's move on to the next question. Because in addition to understanding better who's here, we are also very interested in what is your main interest. Just a minute, so that's the next question. So what is your main interest in hypertensive disorders of pregnancy? And that could be a certain topic or a certain aspect of hypertensive disorders. And again, you can answer it through Mentimeter or you can answer it in the chat. And we have a very rich program this morning of a wide range of topics. And this will also help us to identify topics for future webinars. Koiwah, I'm not sure if you can read the chat, but one interest is being a motivational speaker. And Kingsley is was inspired by your story. Maybe it's nice for you to link up also after this webinar. And I see very many topics listed. So it's prevention, epidemiology, HELP syndrome as a specific subset or one of these disorders, part of the hypertensive disorder spectrum, supporting patient organization, treatment, prevention, clinical features, management protocol, So sociocultural aspects of quality care, pregnancy loss and provider-client interaction, prevention, pre-service education. So this probably also means in midwifery colleges and medical schools to help reduce maternal mortality and early neonatal morbidity and mortality, prediction, epidemiology, improving our understanding. So the pathophysiology. And in the chat, we also see a number of comments. We also see many different organizations are represented. And one of the things that we would like to encourage everyone is to also reach out to each other also after, either through the chat or after this meeting, or through the website or Facebook page of APECGH Ghana, and find each other. So many topics. Thank you for answering. Okay.
Okay. It looks like some people